Our first question is, could the panel speak to the issue of how much the objectives for young adults versus adolescents diverge rather than overlap? Some of the objectives and methods are not pertinent to a campus health setting. What are the rationale for combining the two?
Cherie, this is Trina. That's a really, really important question. It actually is a whole set of questions. In general, like people need to remember, is that in general, that objectives were developed by a large number of categorical work groups. Is that when we developed the core indicators, is that we needed to work with the available material or the available objectives. Our work group was highly, highly, highly committed to making sure that young adults were included as much as possible compared to adolescents, because quite frankly, adolescents receive much more publicity in our country these days than young adults do. And so that what we actually did is if an objective was considered sufficiently important to be included as a core indicator for adolescents, and that if young adults were not already included in it, is that we looked very, very hard to try to find a parallel or a very, very similar objective for young adults. And one example would be that around use of tobacco. Is that the one that we selected for adolescents was around cigarette smoking, and the one for the one that we selected for adolescents was for actual use of tobacco products overall, remembering that adolescents also use other types of tobacco products. However, for young adults, the only one that was similar was around being a current cigarette smoker, so that we included both of those under the core indicator around tobacco use. Now, in terms of young adults that are actually on college campuses, is that the topic area educational and community-based programs specifically addresses educational programs that are available on campuses. And however, there are relatively few other objectives contained in Healthy People 2020 that are specifically for young people who are fortunate enough to be in college. That one of the things that we want to do in the future, assuming that we're able to receive additional financial resources, is to be able to develop content resources for important groups such as college campuses.
Thank you, Trina. Our next question is, in addition to the ways that public health agencies can partner with schools, what can healthcare providers and practitioners do to help students succeed in school? Are there evidence-based strategies that they could use?
And this is Teresa. I'll start with that, and if other panelists have additional comments, I'll ask them to jump in. But practitioners and health providers can display some genuine interest in how your patients are doing in school. Explore what's going well, what are the areas of difficulty, connect with the patient, and ask the high school students in particular what they're thinking about around graduation, what their plans are for the future. A lot of times people don't ask adolescents their plans, and it's helpful for them to be able to have that conversation with a trusted clinician because you have a lot of influence. Problem solve with patients and parents around school issues, if there are academic and behavioral issues in particular. Look at undiagnosed learning disabilities as an issue and ADHD in patients who are struggling, including students who have conduct or behavioral problems in school. Really facilitate some assessment on that. Ask about sleep patterns and eating breakfast. Both of those have ramifications on learning and behavior, and help the patient put together a plan for improving those behaviors. Attendance patterns. Sometimes it's really helpful to ask what is going on? Is the student going to school? What are the reasons they're not attending? And look at whether attendance or missing school is frequent. Also, you can have communication with the school. So working with patients who have individual education plans, if you're not called or cannot attend a meeting, it's important to provide written communications to the school, and really work with school nurses for patients who have chronic diseases, and check and see how their needs are met during the day and how you can facilitate their health services during the day. Also, talk to parents about looking at the structure and support that they're providing at home for their students to succeed in school. Is homework a priority? Is there a place to study in the home? What kinds of meetings are they having with teachers? What's the attitude towards school? You can join a local task force on increasing high school graduation rates if you're interested in attending meetings and making change in the community. And also encourage reading. There are successful programs for providing books to adolescent patients. We often think of that as elementary school level, but Boston Children's Hospital gets financial support from the hospital's Lady Auxiliary to have a reading program for adolescents. So those are just some of the pieces of strategy that an individual can take on and decide what makes most sense when they're working with their patients.